Hi everyone, this is Dr. Krishna here, oral and maxillofacial surgeon. Today we have one patient with us. The chief complaint for the patient was he was having very deep pores on the skin. Okay, right now here you can see. Let me turn the lighting. Okay, see to this patient, the patient complaint was there was deep pores over the cheek regions. Okay, can you see? Entire the cheek region, the patient was having the deep pores. Okay, so the patient wanted to get the treatment for the deep pores. That means basically during his teenage and during now he was around 28 years, and during his teenage he had huge pimples over that area. After that pimples, those has left the scars onto his face that has led to the deep pores, right? So now what I am going to use is we are going to insert the PDO threads. See over here. Okay, these were the various PDO threads that are available. Okay, so what we are going to do, we are going to insert the PDO threads into the face region, that is the cheek area, especially because there are the huge pores which are present onto the cheek area for this patient. So what I am going to do now, I am going to insert these polydioxanone threads into the cheek region. Okay, what basically polydioxanone thread does is it will help in collagen formation for the patient. After a duration of around 3 weeks, there will be new collagen formation. Also, it will help in new vascularization over that area. Ultimately, that will lead to the collagen formation and will lead to the whatever the depth of the pores that has been there, that will be shortened. Okay, now I will be doing the procedure. Already I have administered the local anesthesia to the patient. Now you can see the procedure what I am going to do to this patient. So basically you can mark this area. Okay, you can do the marking for this area, but I am used to it, so I am not doing any markings as such. And is this visible? Okay, this was the thread length. Okay, to this the thread will be up to the 2/3 only. This is the entire length of the needle. For example, this has the entire length of the needle. Okay, in that the collagen thread will be only till 2/3. So all you need to do is just take it, make the skin a bit stretched. Okay, make the skin a bit stretched. Let the bevel of the needle goes towards the skin side, and then just insert the needle along the subcuticular plane. Okay, and make sure you are going till the 2/3 of the syringe. Okay, see, almost it is getting here. Okay, can you see the bulge there? Till then I am going to reach. Then followed by the sequential needle insertions. Okay, so wherever he is having there, just stretch the skin slightly, go below the skin. Okay, in the subcutaneous plane, and then go till the 2/3. Okay, that's how you will do the insertion of the syringes. Almost this is the cross hatch pattern. What I planned is cross hatch pattern. That is, I am going to insert the syringes in a horizontal way as well as the vertical way. If you guys have any doubts regarding the procedure, you can text in the comments so that I can answer to those questions or the queries, or I will answer those in the adjacent post. So I am asking the patient whether he is feeling comfortable with the procedure or whether he is having the pain. So he has told he was absolutely fine with that and he don't have too much of pain. Okay. Now you can see almost around 5 needles I have inserted over here. Okay, you can see now. Okay, all these 5 syringes has been inserted in the direction where there is more density of the pores. Then now in a cross hatch pattern, that is, now I will be inserting 5 more in this pattern, so that it will be like a cross hatch way, and that will lead to collagen formation and that will lead to reduction of the pores. Always just make the tissue taut at the insertion point and then go below the subcuticular plane. Okay, never go too much superficial. Sometimes you will feel the obstruction, then change slight angle. Okay, because already you have inserted the previous things, so slight obstruction might be there. Just change around the region. Okay, then over here he is having, so I am going at a bit upward plane. Now can you see the bulb that has been getting filled up slowly? Okay, the last one. Now after completion of this, almost 5 in this plane and 5 in this plane, so it will be a cross hatch pattern which I am mentioning from the past. Okay, so now after doing this, how to remove this? how to remove this is, you need to rotate this in a 360 direction. Hold it here, rotate it in a 360 degree direction. Okay, see, I am holding it here. Rotate this needle in a 360 degree direction. Hold it, rotate again to a 360. Hold it, rotate again to a 360. Hold it and rotate again to a 360 degrees. Then remove either 2 or 3 needles at a time once. Okay, just apply the cotton there. Yeah, see, there is no thread that has been coming to the needle. Got it? Just rotate it 360 degrees and then remove it. Same way, mild bleeding is there, that also got arrested. Only one has small twig that has been come out. See, we have inserted almost 5 threads, but only one small twig that has been popping out. That to a very tiny one that you can just cut it off. Okay, so we have done with this side, and then we'll do it towards this side. Yeah, so almost here also, only one small thread that has been popping out, so that I am cutting it off. That's it. Yeah. So this was the procedure that have been done, okay, to the patient, and I hope you guys have seen it, and you have understand better about how to do PDO threads for the deep pores management of the face. Okay, hope this live session was helpful. If you guys have any further queries, you can DM me or you can text me regarding the procedure. Thank you all.